So if a child has a severe eating problem, this can, in time, severely affect their health. You can't play around with it. You can't do denial. This is a big mistake. Denial is not a technique that's going to create anything positive. The person is obviously struggling with the reality that the child, the offspring, has some difficulty or difficulties. Denial or glossing over it are useless techniques. They don't work. We need to say, this is the difficulty, this is the problem. I'm going to be fully committed to get the help, the support, to put maximum effort into helping our son or daughter, whoever that is. And yes, these things are embarrassing, they're a bit humiliating, and we would prefer our children to do well, to excel. No doubt, we're all invested in them doing extremely well. And sometimes when they're struggling, they're not doing well, for whatever reason. Denial and going into distraction is certainly not going to improve the situation. There needs to be, in my opinion, more courage, more honesty, more humility, more determination, and to say, this is what I'm dealing with, and I'm going to do whatever I can. Some food disorders come from the past life. Sometimes parents don't set a good example in the form of eating and foods because they themselves have not developed yet discernment and discipline. Everything that we put into the body produces effects. So we can say healthy food are going to produce healthy effects. Unhealthy foods are going to produce unhealthy effects. So we should put as much emphasis in the quality and moderation. We as parents are enormously invested in the growth, the development, the happiness, the fulfillment of our children. And we want very, very much to see as much positive as possible. This is human nature. But we also need to see the truth. If the parents don't realize and accept that their son or daughter has an eating disorder, how is this situation going to improve? I don't believe easily eating disorders just disappear. I think they need to accept the fact that this is the case. Once you accept, you're now in a position to go to a number of professionals who are educated in the area of eating disorders. There is help available. You can't help them if you're in denial that my kid doesn't have an eating disorder. You're not going to ask them to make changes. You're not going to bring in a professional. You're not going to ask your child to see the professional. It's not going to happen. Acceptance allows you to take action. No action is not an action. You go to people who are qualified in the field. You can also go to your doctor. If you have a good doctor and you say, I think my son or daughter may have an eating disorder. I'm concerned about this. Could you recommend anybody in this field? I'm sure it doesn't take too long to hopefully find people that are very, very trained, skillful, and are compassionate. I don't think it's too difficult to see if a child doesn't eat properly on a continual basis. Once in a while, that's one thing. But if on a regular basis, improper eating habits are taking place, I don't think it takes a whole lot of brains to see that my child has an eating problem. Let's just simply put a label on it and call it a disorder, because it is a disorder. So parents that are in denial, that stay in denial, do not want to see that their child has a problem. And if they don't see it, they don't want to see it, they deny it, they're actually collaborating with the child to continue with the same thing. That's a big mistake. But undoubtedly, during an eating disorder, the child is not receiving the nutrients that it needs. This damages the body. It just damages the body. Eating disorders damage the body. And when eating disorders are there long enough, the damage can be permanent. There's a malnutrition component to eating disorders. They're not eating certain things. They may not be eating enough. When our child is doing well, we are flattered. It reflects, hopefully, our abilities and capacities. When the child isn't doing well, have I done everything that I have needed to do as a parent? Have I been lacking something? Have I been lacking something? And I think I've made it plain in many, many classes. I think parenting is one of the most complex things that we do in the world.